I'm Dr. Jamie Koufman, and this is Dr. Koufman's Acid Reflux Hour. Today I'm going to talk about natural remedies for acid reflux. And I had an epiphany when I was reading the questions and realized what I was being asked most of the time. I wasn't being asked, how do I fix my reflux most of the time? Most people were asking me, how do I fix my symptom? And so the idea that there's a thing to fix the symptom, there is. If you have heartburn, 57% will get good results with a proton pump inhibitor. Although proton pump inhibitors are dangerous, I don't think they should be on the market. They have terrible side effects. And guess what? They cure 0% of people's reflux. If you don't know it, long-term use of proton pump inhibitors increases your risk of esophageal cancer. And the reason is because what happens is you take care of the symptom. Esophagus is a quiet organ, and the disease goes on unabated. And that's why a beautiful study done in Denmark, national study, long-term use of PPIs increases your risk of esophageal cancer, but also cures 0% of people. That's a 0% of people. So the question of natural remedies is also needs to be addressed, because I have questions today about people who have had treatment procedures and still have reflux. So I want to make it clear that I no longer recommend any of the procedures, the partial procedures, the links, the strata. They're absolutely useless in the long run. They do not stop reflux disease, and they may make things better for a while. But it's the natural remedies are what count. And I'll get to those natural remedies in a second. So we're not taking proton pump inhibitors. We're not, and even for fundoplication, we're not having a procedure or surgery. And so the question is natural remedies. So the question is begged by, are you trying to fix your symptom, or do you want to fix your disease? Most of the questions that I receive are about how to fix the symptom. I've done this and this, but I still have a symptom. So the remedy part of this talk should be remedial. Yesterday I talked to a nurse who has reflux, and her great pleasure in life is to eat chocolate before she goes to bed. I said, oh, you have a 100% chance of refluxing every night. And she's old enough that she's starting to have symptoms and potentially problems. Her response was, sorry, not giving that up. So if you eat chocolate before bed, I have nothing else to offer you. In fact, if you're eating anything before bed, nothing to offer you. And if you're having a nightcap and alcohol before bed, you win. You get the gold star for worst possible idea. Today we have supine nocturnal respiratory reflux. Lying down at night, respiratory reflux into the respiratory tract, better than LPR, respiratory reflux is a term. So we have respiratory reflux at night while we sleep. We don't have heartburn or indigestion during the day, at least most of us. So for every refluxer, only 1 out of 5 perhaps has heartburn and is aware that they have reflux. That means the whole rest of you have silent reflux. So how do you know you have silent reflux? You have postnasal drip, chronic throat clearing, hoarseness, cough, difficulty breathing, shortness of breath, and all the symptoms that we relate to respiratory reflux. If you have a bunch of those symptoms, you got it. Okay, you don't need a test. Okay, and a good otolaryngologist ought to look in and go, oh, I see you have respiratory reflux. So again, it gets back to the question of what are remedies, natural remedies. So the answer is none of them. There's no such thing as a natural remedy. So taking alkaline water is really the best one you can do. It's the only thing in nature that's completely the opposite of acid, can neutralize acid. I wrote a paper on alkaline water, I think it was 2012, and so began the alkaline water craze. It's only good for one thing, reflux. So when you drink alkaline water, you're treating a lot of places, and Pepsin dies at pH 8, and you're drinking presumably 9.5, and I have a bottle somewhere. I had one. If if you look at my last post on alkaline water, you're going to find little spray bottles. And the little spray bottles are particularly useful. They're sort of a thing on Broadway now. And you don't need those. Those particular ones are convenient. They don't leak. They fit in your bag, pocket, or whatever. But if you take your alkaline water 9.5 and spray it in your throat, when you swallow, it doesn't get on your vocal cord. Error. Your throat clamps tight as a fist. So if you want to get it, you can spray. And I'm really sad that I've lost my sprayer that I thought I had here. But the little spray, open your mouth, and spray when you get up in the morning, spray after meals, and spray whenever you like. And you'll see, if you look at that last post, you'll actually see pepsin in the tissue. So it's about the only thing you can do that specifically washes out pepsin is the spray, and that helps the throat and throat symptoms, sore throat, so on. So the natural remedies. So alkaline water is the best natural remedy we have. And anybody who said, "Oh, I have these terrible symptoms with alkaline water," it's total nonsense. Okay, there's no side effect from alkaline water. I went into the medical literature. By the way, when someone asks me a question, I go straight to PubMed. So I'm not interested in WebMD. I'm not interested in anyone's opinion. I want to know if there's a peer-reviewed published article. And so we know that alkaline water is the best thing we have, and all these other things we're going to go are less. So, but it's a natural remedy. It's a natural adjunctive treatment to real treatment for reflux. So let me make it clear that this is remedial. These are not remedies. It's remedial. If you want to get your reflux better, you've got to stop at 100% for at least a month to give your valve, your lower valve, a chance to heal, your esophagus a chance to heal. So you can't have your cake and eat it too. So, for example, you're really serious, you're going to never go to a fast food restaurant again, period, unless you're going to get a grilled chicken sandwich. Okay? You're never going to drink the Diet Coke again. All right? You're never going to have a snack before bed. You can't have alcohol within 3 or 4 hours of bedtime, period. So the thing that's happened is in the last 50 years, Americans have got reflux, diabetes, asthma, and by the way, let me stop on asthma. For every 5 people who have asthma, 4 of you don't have it. If you have trouble breathing in during an asthma attack, it's not asthma, it's reflux. So I keep going back and forth. Do I have natural remedies to offer? And the answer is, you start with a detox program. And I do a reverse intermittent fast, no eating within 7 hours of bed. If you get hungry, drink chamomile tea or ginger tea. And I recommend you get on my blog. There are posts about everything. There's even a post recently about famotidine, ginger, and chamomile tea. So anyway, alkaline water is also good for pH balancing. If you're making a smoothie and you use little ice cubes made of alkaline water, if you use it as a chaser, you've had a salad with a little bit of vinaigrette, probably drinking water, and when you get home spraying would be a good idea. So all these things are adjunctive. So there's not a single thing I have that'll cure reflux. So, and by the way, a lot of the questions you've asked this particular month, most of them are very good, but there's some really confusing ones, and I'd like to pick them apart. So besides alkaline water, the next one is chewing gum. I had a patient way back when say, I chew gum, my heartburn goes away. So we studied it. We actually put a pH probe in somebody, and we waited till they had a reflux event, and we had them chew gum, and then it went away. Here's what happens. When you chew gum, you make more saliva, more bicarbonate, and you swallow a lot more. Same thing's true of a hard candy. We put Ricola free for people to take in Carnegie Hall, and it reduced the amount of throat clearing and noise dramatically. So Ricola, I recommend personally the big old-fashioned ones. They're in the brown bag, or you order them online. And I personally recommend cinnamon, sugarless gum, because the flavor lasts longer. You can't have mint. So now we've talked about remedies that really make a difference. They help. They do not stop reflux. Okay? If you had 10 things like alkaline water and chewing gum, they still wouldn't stop reflux. But they are good adjunctive treatment. Again, if you're eating late, if your diet is bad, if you drink too much alcohol, if you're obese, all of these things matter. So I'll tell you the other things that I recommend. Ginger is a natural alkaline substance. It has anti-inflammatory properties, and it's been around for a long time. I did not go to see if ginger has been studied, but we've been using it for forever. I personally get a ginger root, cut a couple of pieces, put it in a teacup, fill it up with water, cover it, and I use sweet and low. If you're on a reverse intermittent fast, you can't have sugar or honey because they turn on insulin, turn on glucagon. You want to go to bed with an empty and quiet stomach. So ginger is good. It can be used in cooking. It can be used to make tea, and so on. Manuka honey has been studied. Manuka honey is good for a lot of things. It's even antibacterial. It's good for burns. If you want and you can afford them, Manuka honey and ginger drops are nice things you can suck instead of chewing on gum or Ricola after meals. I think they run almost $1 each at this point. They're the fancy schmancies. So I don't necessarily recommend them. We're talking now about natural remedies, but they're adjunctive treatments. They don't fix anything. None of these things fix anything. Again, if you're having chocolate before you go to bed, you can take all the adjunctive treatments in the world and they will make no difference at all. So aloe vera is good. Aloe vera, I first did when I was making smoothies. You can buy a leaf almost in every supermarket, and you open it and you take out what's equivalent of a little more than a tablespoon and put it in your smoothie. It's good for your whole digestive tract, and it makes your smoothie have a really nice smoother consistency. That's how we use aloe vera. Interesting, you don't have to test this one, although it turns out I went in and I looked at aloe vera. It's been shown about second-degree burns healing better, healing faster. I burned myself recently and I broke off a piece and I had instant relief. And then I did it a couple hours later, and I did it a little bit the next day, and then my second-degree burn was gone and just healed under a Band-Aid. Now we get to the ones that are licorice, slippery elm. There are a lot of them, and there is not a shred of evidence that these do anything. Okay, but licorice contains, it may increase mucus production. Mucus production is good, it's protective. A slippery elm may again help form a gel. So these are in the range of maybe they help, but I don't think they can do any harm. People ask me what kind of licorice I like, and I say I like black and red licorice. When you start looking at these things that you're eating, don't worry if you have an additive that is on the 19th thing of ingredients, and you say, oh, maybe that's bad for reflux. The big one, here's an ingredient you got to watch out for, high fructose corn syrup. Okay, you got to be look at the sugar content of your cereal. I buy Rice Krispies, and they're cheap, and I put almond milk, sliced banana, and a little sugar, and it's delicious cereal. But if you look at all the other cereals, find one that isn't loaded with sugar. It's not the first ingredient. So this is one of the kind of things. Adjunctive treatment is stop eating cereals that are all sugar. And so this gets me back to the general questions of adjunctive food, of adjunctive treatments. And so there are foods that are better. I'm just going to list them at ones that we use because they're high pH. Almond milk, bananas, melons, fennel, actually is a mild licorice. Olive oil, cauliflower and broccoli have a good pH. Whole grains, brown rice, green vegetables, avocados, skinless chicken breasts, wild-caught fish. Those are the biggies. Now, again, you cannot have your cake and eat it too. You can't, I'm doing the diet and I'm taking the alkaline water. But you get home at 7 You eat at about 7:45 and you go to bed at 10. It doesn't matter what you're doing. Now, I do want to talk about some things. Famotidine is the safest and most effective medicine we have in America. There's not anything I can find. So if someone wrote an article about all these side effects, and what they did is they went across the internet and they wrote a magazine article, and anything anyone ever said was a side effect. So I went into literature. Meanwhile, I've treated probably 10,000 people with famotidine. None of them have side effects. I mean, like zero. If you're taking a lot of drying agents like antihistamines and that, famotidine can help with drying. But it doesn't cause headaches, it doesn't cause dizziness, it doesn't cause nausea, it doesn't cause muscle weakness, it doesn't make you faint. So all these things that you think you might have, you don't have because of the famotidine. And it could be wrong, but having treated thousands of people and looked at the literature, it's safe. So I do recommend famotidine, 20 milligrams, one in the morning when you first get up, before 30 minutes before your last meal or feed, and then 2 or 40 milligrams before bed. And I also recommend people who have significant reflux to sleep on a high incline. Alginates are non-medicine medicine, and so all these questions that people have that say, oh, alginates give me, migraine headaches, or alginates make me have tremor, I'm going to ignore all those questions because they're idiosyncratic or they're questionable. So I'm done talking about, basically what I've said is the alkaline water and gum chewing after meals, after eating, are effective and help. But they're two parts out of an 8-part detox program. And if you get bad reflux, you got to stop the reflux completely long enough for things to heal. So if you're just treating a symptom, it doesn't matter. I'm not interested in you. In other words, I don't have much to offer you except the antacids help for this and so on. But I think that the real issue should be how do you treat reflux? And so the answer really is all, and the only answer are natural remedies. Meaning, it's not about pills, it's not about procedures, it's not about doctors. This is one of the few areas where there is no doctor, there is no nutritionist. Reflux is about diet and lifestyle, period. I got a question here. I had a fundoplication. I'm still refluxing. I don't have the rest of the information. What time do you eat dinner? How much do you drink? And look at other reflux factors. And all of them add up. And each person is different. So let me get to some of the questions, and you'll see these overlap somewhat with what I said. But I want to make a firm conclusion. Natural remedies, meaning no fancy pills, no better pills, no procedure, no stupid thing you wear on your neck. None of those things do anything effectively, at least not in the long run. They certainly don't stop reflux disease. So, I recently experienced a severe case of reflux. I don't know what that is, by stressful lifestyle, and that's certainly true. Stress. When I had reflux at the worst, I found the thing that got me going immediately was aggravation. Something happened and I wasn't want to work out, and I had reflux within a minute. So aggravation and stress do cause reflux. And then this statement is really bizarre. Your alkaline water method cured me of my throat symptoms. Well, again, it's a Band-Aid. It may help, but it's not a cure of anything. So now I was wondering if there might be a similar solution for eustachian tubes. So let me stop. This is from Rosie. Rosie, you still have reflux. You have respiratory reflux. And I'd like to talk about eustachian tubes and ear symptoms. It was the last shoe to drop. Several years ago, a man came to me from Washington. He's 29 years old, and he was angry as a hornet as he opened his mouth. He said, I have reflux, I have pressure, I have hearing loss, I have tinnitus, it's reflux. I've been to 10 doctors, I have 40 tests, it's reflux, I'm coming to you, and I want you to fix my reflux. So I had real pH testing. We put a pharyngeal, high-quality pH measuring device in his throat, and sure enough, he had rip-roaring reflux. Now, when you lie down, the back of the throat looks like this, and then there's a trough, a place where you could have a little pond. If you had one reflux episode, it could fill up that little pond. And guess where that pond is? It's right next to the eustachian tube. And we know that people who have eustachian tube and ear problems have findings in the nasopharynx. They have obliteration of the fossa rosum, they have cobblestoning, and so on, thick endolaryngeal, thick mucus. So anyway, I treated him, and he was very grateful. He was cured. So I'm not saying most common cause of tinnitus is just aging, where you've lost some little hair cells from going to a rock concert when you're 16 or whatever. So the sinus problems and the ear problems go together, and the most important thing you can do in terms of, if you ask if there are remedial things, is to sleep on an incline. I'm a big fan of lazy boys. I'll tell you my story. I don't have a reflux forever. I haven't had it for 25 years. My back is bad, and I was eating dinner, and I was lying down on an ice pack, and I started to get reflux. Solution, lazy boy. So I got a recliner like that, and I was comfortable, and I put a little pillow behind my back, and I put my ice pack and all that. So elevation really matters in people who have ear and sinus symptoms. Anyway, you got a lot to do. Look at Reflux Detox on the blog. Okay, that's where I'd start. This particular Patty has sore and swollen gums. I don't know if you've got recession of gums, gingivitis, and any damage. But if you ask me, there may be other causes, but I don't know them. It means you're refluxing in your mouth, and I'm surprised you don't wake up in the morning and taste the bitter taste. But you need to do everything. You need to eat early. You need to be on an incline. You need famotidine. You need the allogenated, and finish talking about that. The three that we're using now are Gaviscon Advance, Reflux Raft, and Reflux Gourmet. I still say Gaviscon Advance is the best because we've studied it, and it's also the least expensive. Get the liquid. People have been asking me this a lot. I recommended the aniseed forever, and I always said, why do they make a peppermint? And the answer is, it's possible. I can't get the answer from the company. It's possible. It's a flavoring. It doesn't have the components of peppermint that make the lower esophageal valve relax. So the answer is, it's probably okay, but I don't really know for sure. Is it real peppermint or something lesser that's not going to have any action on the lower esophageal sphincter? Shouldn't like aniseed. Get the peppermint. Flaxseed oil is okay. Now, I want to make this clear. In your article, you mentioned to take famotidine several times a day. It says it lowers acid, but since LPR is from Pepsin, will this work? All right, let's talk about it. If you have reflux, respiratory reflux, you've got Pepsin in and on your throat, like lobsters. It lashes on and stays there. Guess what activates it? Acid. There's no acid. Doesn't. So if you deprive it of acid and drink alkaline water, pH 9.5 or spray 9.5. So the answer is, if you ask me the question, in people who are saintly in their anti-reflux program, and I'm talking about detox, and I've seen people go from a D to an A in terms of their throat examination in 3 weeks. And so I believe that you can wash out Pepsin in 3 weeks if you're a saint. So this idea that you need an antacid, because Pepsin is very active up to pH 5. That's why I recommend above pH 5 for people who are in detox, and certainly avoidance of things like lemons and limes, the most acidic things in nature. They're not for you refluxers with respiratory reflux. I have a question about B-complex vitamins. Linda, she says, why are B-complex vitamins bad for reflux? I don't know, but when I interview a new patient, I always ask them what they take, and I talk about their medications and their supplements, and it's pretty clear over time that B-complex vitamins do cause reflux, and so do glucosamine and chondroitin for joints. Those are the only two that it's pretty clear from the clinical data. It's my clinical data, so it's anecdotal. I think if you ask women, doctors who know this stuff, women should take multivite, D3 and B12, and the latter two should be sublingual. So here's someone who's sleeping on an incline, is on 2 PPIs a day, and wakes up with sore chest, dry mouth, painful teeth. So this person is a championship refluxer. And 2 proton pump inhibitors and sleeping on an incline is not a reflux program. And so you go read Reflux Detox and start there. By the way, we're now recommending, if you want to do a detox program, no eating and drinking within 7 hours of bed. It's like a reverse intermittent fast. If you get up at 7, you can eat till 3. You go to bed at 10. And it seems to work out with the incline, with the famotidine, with the Gaviscon, with the alkaline water spray and gum. All of it. For a month. No cheating. Detox. I've read that histamine foods affect LPR. Should I eliminate them from my diet? You know what, Brenda, this is a good question. I don't know the answer. I started looking at this and I forgot. And I'll look into it again. To this point, I don't know that histamine foods do. I'm a big fan of eggplant. I'm having a difficult time moving mucus from my throat. I sip on alkaline water all day. You spray chew gum after I eat, and I'm following your diet. But coughing and mucus are my big issues. They are, by the way, the slowest ones. You can get, a lot of other symptoms gone quickly. The respiratory system has a respiratory epithelium. It's mucous membranes, and it makes mucus. And so if you've had reflux for 5 or 10 years, it's like wartime factories putting out mucus. And so it takes a long time. And then if you go into winter, where we all have dry mucus, then you may not get your mucus and throat clearing fixed until spring. But if you have those symptoms, you still have respiratory reflux. So whatever you're doing, it's not enough. I recently had fundoplication surgery, but I still have LPR symptoms, cough, phlegm. Do I have to do a low acid diet to get rid of it? I assume Pepsin must be in my sinuses. Stop talking about Pepsin. Yeah, Pepsin is the problem. Pepsin causes inflammation. Pepsin causes swelling, causes cancer, but it's acid activated. So if you can stop reflux completely, again, for a period of time, there's no reason why your valves and your esophagus won't heal. This person had a fundoplication. Make a comment about this. I've had a lot of people come to me over the years who've had fundoplications, and people who have respiratory reflux, formerly LPR, they often have a partial wrap, or 270, where they wrap it, but not all the way 360 degrees in the wrap. Partial wraps just don't work for respiratory reflux. So if you're going to go see a surgeon, but you need to see a surgeon for some reason, and I'm not saying what that is, but 1% of my patients need surgery. And it's not the end all. Yeah, they still can't eat late. I'll just say one quick story about that. I had a guy who worked on Wall Street. He went around me and had the fundoplication and came back to me angry because he was refluxing. But he went out late to steakhouses, have 2 cocktails, the ribeye steak, all the fancy high-fat foods, the chocolate dessert, 2 glasses of wine. Has a 100% chance of refluxing all night. It's not that the fundoplication, the wrap, where they wrap it around the stomach around the esophagus, it's not that that's gone bad. It's stiff and swollen, this big valve like the little one was. And so if you have had a fundoplication and you go on a detox program, meaning you get rid of all the issues and foods and lifestyle, I mean, we haven't even talked about smoking and vaping and all those things there. But every time you smoke a cigarette or vape, you got about an 80% chance of having a reflux episode. So, Melatonin, very interesting. I spent about 40 minutes on PubMed. You gotta understand, there is no data on the internet, okay? Cleveland Clinic doesn't have data. Cleveland Clinic has some probably young doctor who was asked to write an article on whatever. So anyway, I went and looked at melatonin. Melatonin, natural melatonin, has to do with the day and night light cycle. And there's a lot of data you shouldn't mess with it. Furthermore, for those who take it for sleep, it turns out they usually end up having to escalate doses to the point that they start to have daytime symptoms. So there's not much data, and there's very little data. There's only one article. I looked at about 40 articles, and there's only one article, and most of them say, and even clinical studies where they've done good science, it's iffy as whether it has any benefit. So I don't recommend things that may have side effects that don't have any benefit. So one more question. I have a hiatal hernia. Do I need surgery? So understand that most of us have a small hiatal hernia. If you have a hernia 2 to 4 centimeters, it sort of like goes with the territory. You can have reflux with a hernia. You can have a hernia without reflux. The hernia is not the game breaker. In the 50s, we thought, oh, hernia, let's fix it, like it was a surgical indication. None of that's true. So it means your valve is a little weaker than it might otherwise be, but it's not a game breaker. So anyway, thank you all. This has sort of been all over the place today. It's a hard thing to talk about when you want to tell people that reflux is not a medical problem. It's not a pill or a doctor or a procedure going to make it go away. Sorry. You are the doctor. Gastroenterologists decided to put scopes down people and make money owning surgery centers and don't know anything about respiratory reflux. If you go to a GI with respiratory reflux, you're wasting your time. But your ENT doesn't have training in it. Lung doctor doesn't have training in it. So I'm telling you that I've written everything I can possibly write on the blog. It's not organized like a book. So indeed, I'm writing a book, Respiratory Reflux, How Silent Reflux Causes Diseases. And if I'm right, 100 million people have it. That's a lot.